As you can see, no one's talking to me. Hi, you want to answer some questions about healthcare? Your opinion? We're making a documentary. See, no one wants to talk to me. I mean, I'm fine, I'm nice, I'm cute. Kind of. I'm kind of nice. The issue is actually just the fact that it costs too much. Not that we even have to pay for it, but that it costs too much.
Yeah,
yes.
That it costs
More than zero is too much.
More than zero is too much.
I want to help make sure that people understand what is driving up the cost. That way we can solve the real problem, which is cost. Rand has a unique way of looking at the problem, different than what I hear other politicians say. Because when you lower the cost, you also make it more accessible to people. So you fix the problem of accessibility by fixing the real problem of cost.
I think they missed the boat if we're only talking about access and not expense. The other thing you have to understand is if you increase access, give more people insurance, you will increase overall expense.
What do you think is the biggest problem with healthcare?
I guess that everybody can't get it. Or like middle class people, I guess. I'm not really sure.
Yeah, when politicians are always throwing around these figures of the amount of people who are uninsured in America, you know, you kind of get freaked out. It's like, oh my gosh, that's so many Americans don't have health insurance.
What percentage of American citizens don't have health care insurance, would you say?
46 million people don't have insurance. A third of those people make more than $50,000 a year. So they're not buying insurance because of the expense. A third of the 46 million are eligible for Medicaid. They are poor, but they're not bothering to sign up for Medicaid because it's just not worth their time. 20% of the 46 million are not citizens. If you look at the 46 million, about 30% of them will be without insurance for less than a year. They're young, they've just gotten out of college, they either haven't gotten their first job or they're in between jobs.
You realize it's not as shocking, staggering, or scary as the government makes it out to be.
It's not to say that there's not a problem, it's just to say that of the 46 million, there might be some other solutions other than a government solution.
The issue really isn't the accessibility. We all can get help when we need help. You know, Mitt Romney has been sort of touting his whole plan in Massachusetts and how well it worked because everybody in Massachusetts is covered.
We got everybody in Massachusetts insured, and we did it without putting government into the insurance business.
The real problem is that it still hasn't made health care more affordable. Rand Paul says the biggest problem with cost of health care is the fact that we don't have capitalism in our current health care system.
We have a system that's broken, but it's not broken because we have too much capitalism. It's broken because there's not very much capitalism in healthcare.
So you can say, well, okay, what does that mean? Why is that the problem?
Why can you go to Walmart and get your cell phone, a Go phone, for $14? Everything is so cheap. iPods come down, all electronics so cheap because there's price competition. You need that in healthcare.
Well, prices are fixed. You don't have flexibility in prices. So you as an individual, you don't get to shop around for a better deal. It's going to be the same everywhere you go, and it's going to be insane. Few realize that health maintenance organizations, HMOs, the companies that drive a wedge between the patient and his doctor, were a product of federal legislation and special interests. The HMO Act of 1973 essentially granted unfair privileges to certain sorts of companies and led to a distortion of the market. This has caused higher prices, less coverage, and more bureaucracy.
Because I think a lot of people want something to be less expensive and free. So people are used to with healthcare, they want to go in and they don't want a high deductible, they don't want a copay, they just want it all paid for.
So you're from Toronto.
I'm from Ancaster, Ontario, Canada.
How do you like your system?
It's amazing. Everyone's covered under the same umbrella.
You have to get in line, though. The problem is everyone is covered, and it's a free, you know, everyone's free, but unfortunately because everyone's, you know, the option is there for everybody, you have to wait.
My goal with healthcare is to have much higher deductibles, and you pay every time you go to the doctor. And people go, oh no.
Oh no. Oh no.
They're afraid of that, so that's counterintuitive. They think it's not the right way to go.
How do you feel about, like, if you were to pay for the doctor out of your own pocket every time you went, how would you feel about that?
I'd probably never go.
People say, I don't want a $2,000 deductible, I want a $10 copay. But if you have a $2,000 deductible, your premiums go down. So instead of $800 a month, maybe you're going to pay $800 a year.
What if it was cheaper for you to pay each time you go to the doctor than it were to pay for insurance? Then would you?
Yeah.
The current costs of healthcare are so huge, of course it's a scary thing.
There was a friend of mine was in Florida, and she was drunk and she screwed up her knee. And I think the bill came to $25,000 and she's a student.
If other Americans could see it this way, and could see the need for capitalism in our healthcare system, and we were able to achieve that, then I would be able to afford insurance for, say, a catastrophic event. I'd be able to afford that by paying a higher deductible, and then when I have to, and then pay out of pocket for, you know, my own other doctor's expenses. We could afford to do that with capitalism.